stasis things, but I thought, with all the illnesses going around, I'm just gonna give a quick commercial about colds and flu things. So right now there are 3 things sweeping through Santa Clara County flu. And unfortunately, they're all on the rise. And their symptoms are kind of overlapping, so it's really hard to know what is what, because they're all acting the same and they're all hitting the same time. And getting one doesn't mean you can't get the other. And so I had one person who had a cold-like thing, and then all of a sudden she was exposed with COVID. And so there's nothing that says you can't get COVID with RSV, RSV with COVID, flu, whatever. But they're all here in San Jose at this very moment and on the rise. And in my office, boy, these past 2 weeks, we're getting a lot of calls who are positive for COVID and who have cold symptoms and not positive for COVID. So I wouldn't let your guard down, because it's all flaring. And right now in the hospitals, most of the beds are filled with RSV patients and not COVID patients. So it's just a complex thing. And the typical flu is also out there. So I had a little baby who was 12 months old, and she tested positive for influenza. So again, typically babies get the RSV, but she actually had the flu. So we have to be careful. They're all very contagious. So RSV is as contagious as COVID. And it's mainly respiratory, but also you can get it from contact, but it's mainly respiratory. So their symptoms, anything that you think of that's related to colds and flus, cough, runny nose, congestion, fever, shortness of breath, wheezing, sore throat, it applies to each one of those things. And so since COVID changed a little bit, it's not as distinct as it was before. It actually is mimicking a cold or allergies or something, so they all look very much alike. And so it's really hard to tell what is going on. But knowing tells you the history of what's going to happen next, and maybe how you might change the treatment. The distinctive things about each one, even though they all sound alike, is that if you hear loss of taste and loss of smell, which is not common now with the new COVID, that usually is more COVID rather than RSV or flu. Flu usually doesn't have it, RSV usually doesn't have it. But that is something that is more unique to COVID. But even most of my COVID patients now aren't getting it. So that kind of, we're losing that little distinction. The other thing that's kind of interesting about flu is typically flu hits you hard in the first 3 days. So I always tell people, if you feel like you got hit by a truck, hit by a truck, hit by a truck for the first 3 days, think flu. And then usually around day 4, oh my gosh, this is the first time I can get out of bed and do things. I felt like I was dying yesterday, and all of a sudden now I feel better. And so that's a kind of a characteristic of flu. And usually after 3 days, they just feel so much better. Okay? Whereas COVID usually drags on longer, RSV can drag on longer. But flu, they just miraculously, I was bedridden yesterday and now I can do things. I don't feel well, but I feel so much better. And usually with flu, it starts getting better fast. Okay? The thing that we have to worry about is that people say, well, RSV is a childhood disease. Can adults get it? And so adults can get any of these things. And so a lot of the adults are getting RSV as well as the little kids. And the people who get hit the hardest are the same population, so young people and old people. And you can die from COVID, you can die from RSV, you can die from flu. Okay. But if you're in that middle group, usually it comes across as a bad cold. But elderly or young kids, especially 12 months and younger, can get hit pretty hard. Okay? So, how can you diagnose it? Okay, so luckily there are tests for each one. And so You can do a nasal swab for COVID. You can do a nasal swab for RSV, and you can do a nasal swab for the flu. So there are tests that you can, rapid tests that you can do. The COVID rapid tests are not very accurate right now, but the influenza and RSV tests are pretty good. Okay. Why would you need to know? So the reason why you need to know is because if you're gonna treat it, the treatments are totally different. And so if it's COVID, we have the Paxlovid, which is an antibiotic that has to be started in the first 5 days. Okay. If it's the flu, there are flu antibiotics that has to be started within the first 48 hours. So the timing, the treatment is totally different, and the timing of when you can treat is different. And there is a treatment for RSV, so there is antibody infusions that gives them some immunity, and there's ribavirin, which is an antiviral that can be used for RSV. But typically, we just kind of treat symptomatically and let it happen. Okay. Vaccines definitely work well for COVID. So the data is now coming in for the bivariant booster, and the Pfizer and Moderna both are doing much better than the old vaccines. So the vaccines are working to prevent the new Omicron variants and things from doing nasty things. And it's much, much better than the old vaccines. Flu, we have flu shots, and so we have flu vaccines, and it comes in different flavors. There's nasal vaccines, there are sub-Q vaccines, there are the intramuscular vaccines. And then RSV, there's not a vaccine yet, but they think that it might be out next year. And so what they're gonna try to do is give it to mothers so that it passively protects the baby when the baby comes out. Okay, so, but they're hopeful that in the next year, maybe 2 years, the RSV vaccine will be out.